I'm joined now by the Chief Executive of the NHS Confederation, Matthew Taylor. Matthew Taylor, good morning to you. Thanks for being with us. So, look, how are patients going to be affected by the knock-on effects of the industrial action?
Well, I think the first thing to say is that the NHS coped as well as can be expected with what happened yesterday. And I think that's a combination of two things. First of all, the planning that went into preparing for this industrial action. And secondly, the public made less use of 999. And I think we should thank the public for doing that. But it does mean that there will be pent-up demand. So we are expecting a very busy day for emergency departments today. But also yesterday, there were knock-on effects, more 111 calls, and that has led to more people being referred to GP services, out-of-hours services. So, this industrial action has an effect. We just about coped yesterday, although there are immense strains on the health service as a whole. But we can't afford to drift into further industrial action across the winter.
Yeah, you're saying coping. Just about getting by. I mean, some are saying that this is what a collapsed NHS looks like. Would you agree?
Well, we know why the NHS is facing the challenges that it's facing. We have 130,000 vacancies, and that's part of the reason why the trade unions are taking action, because of the problems we have with recruiting and retaining and motivating our staff. We know we haven't invested the capital that we need to invest. We had the 10 years of austerity. It meant we went into COVID with 100,000 vacancies with a crumbling estate. So what we've got now is a big gap between demand and capacity. And even though the health service works flat out, we've more or less eradicated 2-year waiters. We're making good progress towards getting down to 18 months. So we are making progress, but we've got this gap between demand and capacity, and that gap is going to take time to close. And whilst we've got that gap between the demand and the capacity, then things are very intense, and they're particularly intense always in the winter, which is why this is the worst possible time for industrial action.
Yeah, and that gap between demand and capacity, Matthew Taylor, you say that there is that gap and it can be closed. I mean, I do wonder, can it be closed? Can we close the gap between demand and capacity for the NHS?
Yes, I think we can if we have consistent funding, and we need the right policies. I'll give you an example. There is money that has now been made available to help get people out of hospital into community settings, give them support at home, and that is very welcome. The problem is that money wasn't announced until a few weeks ago, and so it's not been able to get through to the front line. Now, that money's been promised for the next 3 years, so hopefully by the time we get to next winter, we'll have in place mechanisms which mean we have fewer people unable to leave hospital, because it's the people who are unable to leave hospital, even though they're ready to, they're medically fit to do so, which means that we have no beds in hospital, which means we can't get people out of emergency departments, which means that emergency departments can't take people, which means ambulances are stacked up at the front. So all of these issues are connected. If we have consistent funding, if we address that workforce issue, we've been calling for years for a workforce strategy. We've been promised one next year. So there are signs of hope looking forward, but we're paying the price now for those 10 years of austerity, for the COVID backlog, for not addressing these issues. So this winter is going to be incredibly tough. There's nothing we can do about that. But the industrial action adds to what is already a challenging situation, which is why, on behalf of leaders in the NHS, I repeat the call to the government to re-enter negotiations in good faith, for the trade unions to re-enter negotiations, and to try to find a way of avoiding further industrial action across the winter.
Now, the government say they're not going to talk about pay at this point. I do wonder, Matthew, I'd like to get your opinion on the RCNs and their demand for 5% above RPI pay increases, about 19% right now. Do you think it would be better strategically for the RCN to perhaps come in with a lower pay demand that might well get negotiations going?
Well, look, we all know how negotiations work. People have starting positions, and everyone knows that the outcome is somewhere between the starting positions of both sides. The problem we've got now is that because the government refuses to negotiate about pay, and because the trade unions refuse to enter negotiations if pay is not on the table, we've got an impasse. And it's going to require leadership. It's going to require creativity to get out of that impasse. Somebody needs to move. I think probably if the government was able to say, we'll talk about pay in some way or other, that could bring the trade unions to the table. So look, I understand where the trade unions are coming from. I understand the concerns of their workers about pay. I understand this isn't just about pay from their perspective either. I also understand the challenges facing government on public spending, on a range of industrial disputes they're facing. But we need leadership, we need imagination, because the health service cannot deal with a winter of industrial action without there being severe effects on patient well-being.
And last thought from you, Matthew Taylor, what is your advice to people who need to use the NHS in the next few days and weeks?
So we're grateful to the public for the way in which they reduced demand for 999 yesterday, but there will be pent-up demand today. But the really important message is if you have a health need, the health service is there for you. Primary care has not been affected by the industrial action. If you have an emergency, call 999. Because, one of the reasons we are where we are is because during COVID, people didn't come forward. That's why we've got millions of people on waiting lists. It's why many leaders I speak to say that the people coming into emergency departments have more complex and difficult challenges. So it's actually not in anyone's interests for people not to come forward. The health service is under immense pressure, but it is there for you. If you have concerns about your health, contact your GP. If you have an emergency, contact 999. If you're not sure, ring 111.